Evans, thank you for speaking to me. Just wanted to begin by asking about your work, really. What is it that you're doing out in the field?
I'm actually a lecturer under the Ministry of Health, the training wing of Ministry of Health, that is at Chainama College of Health Sciences, based in Zambia. And my specialty is climate change and health, more especially training environmental technologies, what will be the impact of climate change on health, and which we are actually facing right now in Zambia. We're seeing it.
And what kinds of impacts are you seeing?
In terms of impacts, right now we are seeing an increase actually in diarrheal diseases, and we are seeing an increase in malarial diseases. We are seeing an increase also in malnutrition, because as we are aware that climate change will impact on rainfall patterns. Less rains that we have, then agricultural productivity yield is getting compromised. Like this year, we will not have bump harvest, so we anticipate malnutritional cases to increase actually. Yeah.
And how are you responding as a country to these challenges?
How we are responding as a country to these challenges, I would say it's quite challenging, because initially when we looked at the Millennium Development Goals, when they were given to us, we went in our development through that, but with the coming in of climate change, I think it's a challenge. We have just started developing some model that we are going to use for mitigation and adaptation.
And can you give me an example of some of the community level responses to climate challenges?
In terms of the community response, actually I would say the planning has just started at national level, and then it plans to go down to the community. And the projected adaptation challenge measures that we have put in place is actually household water treatment, where we engage the local community who are using shallow wells, contaminated shallow wells. We actually encourage them to go into household water treatment methods like chlorination, boiling, and all those other methods, just to prevent the spread of diarrhea and other typhoid and other waterborne diseases.
Yeah. Just what are some of the lessons you've learned here? What's been the value of this conference for you?
For me, this conference is very much valuable, more especially with the site visit. I think we went to site number 1, Mini Hitch community, where we looked at, we learned more about how they are doing their biogas project and efficient stove projects and their irrigation project. I think for me, it's an eye opener. Yeah.
Evans, just one final question. What do you see as the future now after this conference here? How will you take your lessons and apply them?
After this conference, I think I would go back and urge my community to be more practical, like the way I've seen here. I think we need to go and do more on how best we can prevent these climate change sensitive diseases that I've just talked about.
Thank you very much for speaking with me.
Thank you very much.